Hi everyone, welcome back to the Career Discovery Sessions. This week we have a special guest for our medicine-driven students who will learn more about intensive care consulting, especially in medicine and anaesthetics, from Monica Trivedi. Welcome.
Hi there, my name is Monica Trivedi. I'm a consultant in anaesthetics and intensive care medicine at Addenbrooke's Hospital in Cambridge, which means that I spend some of my time working in intensive care and some of my time in the operating theatres putting people to sleep for their operations.
Great. And can you tell us more about what the day-to-day job involves? What is it that you do?
So it's very varied. So on the days that I work in the intensive care unit, which is the biggest part of my job, I will go in the morning, get a handover from the team that's been on overnight, find out about the patients and what's going on with them, and then look at them all in depth. So we look at their different organs and what's working and what needs help, and how we can help them progress their care. And then we follow that up with doing lots of different procedures that we need to do, different investigations, and talking to all the experts in the hospital that we have at our disposal to get the right things to that patient at the right time, because those are the sickest patients in the hospital. So that's kind of quite exciting. It can get very stressful at times. Obviously, it's a very fast-moving environment. Patients might deteriorate very quickly. You need to be ready to act in an emergency. We get sick patients coming in all the time from the wards or from the emergency department or the operating theatre that we need to stabilise. So it's a really fast-paced kind of work, and it's really fun. And then other days I work in the intensive care, in the operating theatres. And with that, it's a very different pace. I'm looking after one patient at a time. They're people that have come in from home to have a planned operation, and they have all the worries that you would have if you were about to have an operation. Is it going to be painful afterwards? Am I going to make a recovery? What might go wrong? So talking to them beforehand to find out what's wrong with them, and how we're going to do their anaesthetic, and then see them all the way through till when they go home. So get them through the anaesthetic, make sure they're comfortable afterwards, and check on them again after that. That's the clinical part of the work, the actual things I do with patients. On top of that, in medicine, you do have to do some degree of non-clinical work, so not directly dealing with patients. For me, I do more management type stuff, so that might involve looking at standards that we have set for ourselves locally or standards that have been set nationally, and checking our data to see whether we're meeting those standards or whether there's something we need to do to improve, because a lot of the work in the NHS is just about continual quality improvement. Other things that we might do include setting up new services or making sure that those new services are running well, or looking at where our department might overlap with another department to make sure, for example, patients coming from the emergency department to the intensive care unit, does that pathway work well? So a lot of meetings with people to see, does this work, does this not work, from an organisational point of view rather than individual patients. Other people might spend that time doing teaching. They might run courses or teach medical students, and others might do research. So there's lots of different opportunities to do things as well as the medicine aspect. So it's a really challenging and varied job.
And is that your favourite aspect of the job? What is it?
I really like dealing with patients. I still like that bit the best. And I think it's the most rewarding part. You really feel like you make a difference to that one person who is in front of you and is often quite scared and quite unwell, and you've got the knowledge and the skills to help them. That's really rewarding.
Great. And what is the most challenging aspect?
Oh, there's lots of challenges in medicine. It's very stressful quite a lot of the time. There's a lot of time pressure to get things done in a timely manner, especially when you're working somewhere like intensive care where every minute can count. You have to be polite and professional all the time, even when you're tired, even when you haven't had lunch. You have to keep up that professionalism all the time. You have to deal with a wide range of people, some of whom might be, because of the way that they're unwell, they might be quite challenging in the way they might make it difficult for you to deal with them. So there are lots of different challenges. And then medicine's a thing that's changing all the time as well. So you never really know all of it. So you're in a continuous journey to improve yourself and to develop yourself professionally all the way through your career.
So you speak that medicine is changing. Where do you think the field is going in the future? Is it expanding, or your particular part of it, where's that going?
So as a career, because of the number of patients in hospitals and changes to working hours, there are more and more doctors needed. So you probably hear in the news all the time the need for more medical student place. There will always be more doctors required. But I think quite a lot of what's happening in hospitals is about using newer technology so that you can use the skills of doctors in the best way that you can. And not just doctors, but also nurses and other staff in the hospital. So one project I'm working on at the moment is looking at monitoring devices. So devices that you can put on a patient's chest or on a finger that they can walk around with on the ward. They're not tied to the bed. They can move around and you can monitor what's happening with their blood pressure and their heart rate and their temperature all the time. And it's being fed back to something centrally that will alert you when they're becoming unwell. So that's a really exciting new way of doing things. Instead of somebody coming to the bedside every 4 hours and checking everybody's temperature, the patient can just move around, do whatever they want, get some exercise in, which is quite difficult in hospital to get people moving around. But you're using high-tech solutions to do one part of the job, which means a nurse might then be freed to talk to the patient or make sure that they've eaten or other aspects of care that need a person. So likewise, other technologies being used in theatres all the time are robotic surgery, new bits of kit that might make operations shorter or less invasive. So there's always development in that direction.
Can you also speak about some similar careers in the field to what your job role is?
So there's obviously nursing, which is a huge area, and there's what we call allied health professionals. So the other professionals that might work with us on a daily basis. So that's physiotherapists, that's dietitians, occupational therapists, pharmacists, and increasingly everything we do involves that whole team, because if you want to look after a patient, there's no point me just going in and doing my medical bit. I need to know the nursing bit and how mobile they are from the physio and what drugs they're on from the pharmacist. And then we can make the best decisions for the patient overall as a person, rather than trying to look at all these things separately. And I think all those other professions are now more and more respected within hospitals in a way that maybe 30 or 40 years ago they weren't as much. And in fact, all of them now have a route to become consultants themselves. So you can become a consultant pharmacist, a consultant physiotherapist, a nurse consultant. So you can get enough expertise in your field and experience to get quite a highly paid job, which is on a par with a medical consultant. So I think they are definitely other careers to look at if you're interested in working in a hospital, but you think medicine isn't necessarily for you. There are many other options that you can look at. Then there's things like biomedical sciences, so the people that work in labs, so looking at blood cells or looking at the chemistry of blood. There's researchers, there's a whole variety of things.
And what would you suggest the key skills are to work in your placement?
So you need quite a portfolio of skills, really. It used to be, if you were clever, that was probably it. You just need to be able to pass exams. I think there's increasingly recognition that it's not just clever people that make good doctors. You need a range of other things. You need personal skills. Mm-hmm. You need to be able to manage your time and manage your work effectively. You need to be able to make decisions in whatever branch of medicine you're doing. You definitely need communication skills. So you need to be able to talk not just to patients with empathy, but you need to be able to communicate with that whole range of other professionals I was mentioning earlier. You need to be able to have some degree of practical skills. So most branches of medicine, there will be some practical procedures to do. And there are so many different branches of medicine. Which one of those is the most important will vary a lot. So obviously, if you're a neurosurgeon, your practical skills are probably more important than your communication skills. If you're a GP, you'll probably do fewer practical skills, but your communication skills are absolutely vital. So I think everybody needs all those skills, but you can find a thing that fits you according to your strengths.
I know that the field of medicine is very practical, but it also involves a lot of theory and a lot of education. Can you speak about your path to get here? What did you study and what were your first experiences in the field?
So I went into medicine at a time that was still, most people went the traditional route. They did their A levels, which had to include chemistry, and then you picked a medical school and you applied and got into medical school. Now there are more tests to do to assess you. So the BMAT test, for example. That there's a couple more hurdles to pass before you get into medical school, and I think there's a greater need to demonstrate that you're a rounded person rather than just somebody who's academically talented. And that's because it takes a lot of money and a lot of time to train a doctor. So they're really trying to just find the right people to put in those training posts. So they want to know that you're someone that has interests outside medicine, that you're a balanced person, because in your later career, you'll need to have some work-life balance. They need to know that you're able to communicate in some way. They'll need to know that you are maybe community minded. So there's a need to show some kind of degree of stuff you've done within your community, and as much experience as you can have had about medicine and the environment, purely because they don't want you to get to the end of 5 years and go, actually, I don't really like this. So those are why they make it so difficult to get into medical school. Once you're in it, you spend a lot of time doing short placements in lots of different specialties. So that's your only little taster really that you get of hospital medicine. So people who look after hearts or lungs, surgery, anaesthetics, looking after children, women giving birth, intensive care and anaesthetics, all those things you may get a short little taste of. And then based on that, you're going to have to be forming your ideas of what you like and what you don't like very quickly. When you finish medical school, you take a set of exams and you're then ready to go on and do your foundation year. So the absolute basics of becoming a doctor. And that's in a way when the training really starts, because you have to then learn to work as a doctor. So you do 2 years that cover a range of different specialties doing that. And then you really have to commit to something to start training in, whether that's general practice or medicine or surgery. You're not absolutely confined to stay in that. There is some flexibility to move, but you have to sort of narrow it down to something quite quickly. When I qualified, it was a lot more flexible than it is now. So after my initial year of pre-registration training, I managed to go traveling. I managed to go and work in Australia, which I think is still possible to do, but perhaps a little harder than it was then. And then during my training, I've also been able to take more time out to go work in Australia, to work as an expedition medic, to work in a clinic in India, to get some experience of developing world medicine. So there are lots of opportunities to travel and see different aspects of medicine if that's what you really want to do. It's not for everyone, but if you want to try doing those things, it's a fantastic career for opening up doors to do that kind of work. Training in medicine is a lot more supported now. There's always people around you while you're in your training posts to ask for help. But it's a massively steep learning curve to go from somebody who's just left university to being the decision maker in a team. And you've got about 10 years, probably several sets of exams, and a lot of hard work and unsociable hours to get there.
Right. And what about the students of my age, so 16 and 17? What do you suggest that they do to pave their path in the right direction in the best and swiftest way possible?
So I guess the first thing to ask yourself, if you're not sure whether you want to do medicine, is to really think long and hard about it. As I said, it's a long career, it's a lot of debt, it's a lot of time. And I know people who have fallen into it because they had good grades and they liked science, and they hadn't necessarily thought about what life as a doctor is like. So make sure you're fully aware and you talk to as many doctors as you can, get work experience when that's possible, to see what that hospital environment is like and whether you're really going to want to get up every day and do that. Because it can be a difficult and stressful job. And maybe what you're really interested in is one of the other allied careers in science or allied health professionals or nursing around it. If you definitely want to do medicine, I would say it's really important to demonstrate that you are that well-rounded person, as I was talking about earlier. So you need to make sure you've got other hobbies and interests beyond the academic. And that's for a really good reason, because you do need a valve to let off all that stress and pressure of the job. So it's really good to know that you've got other ways of meeting people who are not doctors and other things to do that are not work, that help you kind of balance your mind out. So that's why I think it's really important to make sure, even from an application stage, you're not just going through the motions of putting things in an application form. You are making sure you're the kind of person that can do all those things. And I think probably as medical school is quite a short time to kind of see all of medicine, to spend all your time thinking about which specialties you might be interested in and not be interested in, because you need to have a pathway to go forward. If you follow that, if you've got a pathway to follow, it makes the hard work a little bit more bearable, and it gives you a direction that you're following, but you can always deviate from that as you go on.
Perfect. And is there any final advice that you have for just in general students, not just for medicine students?
Well, I guess it's what I just said, really. So if you have a plan and you're following a plan, it helps to drive yourself forward. It doesn't mean you're committed to that plan for life, but just you can measure up other things as you go along. So if you say, I like this career, but actually I like this one a bit more, a bit less, you can continually sort of push yourself forward and find something you really enjoy doing, because you're going to be doing it for a really long time.
Thank you so much for speaking with us today. It's been wonderful having you here.
Thank you.
Thank you for being here with the Career Discovery sessions. I'll see you next week with a completely different speaker in a completely different field. Bye.